Have you been in any high-risk areas like airports?
As testing for COVID-19 continues, the necessary tools are already in high demand across the country.
And we identified early in the process that the collection kits for testing COVID patients were on short supply.
But in an engineering lab on the University of Missouri campus, Michael Abshire watches as a solution is taking shape.
And these happen layer by layer by layer over a 12 to 14 hour period.
Here, 3D printers from Form Labs are programmed to heat up resin, molding it into coronavirus testing swabs. The swabs are hung in a heated infrared chamber for curing, then they're tested. A machine applies force to make sure finished swabs break under the correct amount of pressure.
The reason to break the swabs is to make sure they're not too soft and too bendable, or they're too stiff and brittle.
Abshire and other cross-campus volunteers are using 5 3D printers, working to produce 1,000 swabs a day for MU Healthcare. It's a collaboration that's already paid off.
It was really neat to see everyone pull together. We identified a need, we were able to find a solution, and we at MU Healthcare did not have the expertise to manage 3D printing, whereas our colleagues at School of Engineering have used printing in the past.
Teaming up in the fight to contain COVID-19. From the University of Missouri, I'm Megan Noe.